Living with pain can affect so many aspects of life, from your mental health to your relationships to just your ability to move around. And treating the root of the pain is so important, especially when medication just can mask the symptoms. Fortunately, it's now easier to get treatment with a new law. I visited Dr. Josh Bailey with Rehab Associates of Central Virginia to learn more.
It's been changing over time. We've been working with varying bills since 2005, but this year on July 1st, a new bill was passed in the state that allows what's called unfettered direct access, meaning that there are no time limitations associated with those that come directly to physical therapy.
So tell me about that in the long term then, because actually if you go to physical therapy, you get some amazing outcomes and you are less likely to have to take medications.
Sure. That's one of the key things is, that we all, I think, are aware of drug dependencies. And many of the drug dependencies that are present today initiated with pain medication. And when they can no longer get pain medications, sometimes they become illicit drugs. One way to prevent that is take care of your pain by physical therapy. And allowing people to directly access physical therapy when their pain first starts is a key, right first step.
Right, exactly. And that means you don't have to go to your doctor, your primary physician. You all are doctors. You can walk in there. You don't necessarily have to walk into the ER. You just go and you get treated directly.
Sure. And, our job is to still work with your family doctor or your orthopedic surgeon or whomever. And we're screening patients for bigger issues.
Mm-hmm.
Many people are like, maybe I should get an MRI to know. We can help know when you should get the MRI. And many times, the statement that we make to patients is, we can treat typically a full plan of care for the same cost as the MRI.
Wow.
And the MRI really has no ability to ever fix you. So if they're necessary, they're absolutely necessary, and we're going to refer you to your family doctor to help make that referral.
And treating that underlying issue as well. Medication can mask that pain, but if you're not treating your weakness or other issues, then you're not going to get fixed in the long run, right?
Sure. I mean, our primary job is to look for the source of your problem. And many times you may have leg pain that is initiating from your low back. And we're trained to recognize the signs and symptoms of that. We're going to test for that, see if we can reproduce the pain, see if we can resolve the pain, and that's going to help us guide the treatment. And the key to that is getting the treatment early. Mm-hmm. The sooner we can get the treatment, the better the patient response is, and the better it is on their pocketbook. It's a huge cost savings. There's great data that indicate that anywhere from $1,500 to $2,100 savings per case.
Wow.
When physical therapy is the initial source.
So speaking of which, when should somebody come and see you when it comes to pain? What kind of time period is too long to be living with pain?
So the best data says the first 14 days. Now, we've all had bumps and bruises that go away on their own. And so what I tell my patients, if it hasn't resolved in 7 days, it's probably not gonna.
Mm-hmm.
Go get some help. And maybe you don't need a full course of physical therapy, but maybe you can get the education that you need to get it solved on your own. That's part of our job too. So it's not like when you come to a physical therapist that you're going to stay with a physical therapist forever. That's not our goal. Our goal is to get you well, teach you how to manage it, and teach you not to have that problem again.
And you also have dry needling now at all your offices. I've tried this myself. It's pretty amazing.
It is, and that's one of the great things about this new law is dry needling used to require referral for a physical therapist to provide it. It no longer does. Now, there's still some referral requirements for those that have federally based insurances. For your insurance to pay, you have to have a referral. But for commercial based insurances, nearly all of them allow it. And we can dry needle everyone who needs it.
And the great thing as well is you guys are convenient. You have many area locations to help serve you. And if it is feeling like I need to be seen today, you might be able to fit people in that day.
Sure. One of the things that we do is we have a common scheduling number. So we have one phone number to call that our origination specialist can access all offices. And the purpose of that is so that we can talk to the patient and figure out what's important to them. Is time of service the most important thing? Is location of service the most important thing? Or is this specialty service the most important thing? And our origination specialists can help patients get scheduled at the right place at the right time with the right provider to get the
Award-winning year after year. You guys have been very successful in this area.
Thankfully, we have, and we owe that to our staff. We have staff that are completely dedicated to being the best they can be in their field. We consistently rank in the top 10% internationally on clinical outcomes, and that comes from people working hard every day to get better at their jobs.
And speaking of which, great place to work for, and you are hiring now, and the sky's the limit.
It is. There's the quote-unquote graying of America. There's more people going on Medicare every day. And because of that, the need for physical therapy is growing. And so we're growing locations. We would love to add additional staff members. So please reach out to me. I'm more than happy to talk to you about how we can grow together.
To learn more about physical therapy or job opportunities, you can give award-winning Rehab Associates of Central Virginia a call at 855-RACV-4PT. Find them on social media or online at racva.com.